Our next topic will be viral infections with distinct dermatologic manifestations. The first of these that we will be taking up would be the warts. Warts are caused by a virus called the human papilloma virus. It is a DNA virus that replicates in the nucleus of epidermal cells. There are 4 types that we will be discussing today, namely Verruca vulgaris, Verruca plana juvenilis, Verruca plantaris, and Condyloma acuminatum. Verruca vulgaris is also known as the common wart. It presents itself as elevated round tumors with a rough grayish surface, or as flesh-colored vegetative papules or nodules studded with black puncta. They're commonly seen among children and usually found on the extremities. And the types of human papillomavirus that are responsible for this or that cause this are the types 1, 2, 4, 27, and 57. Verruca plana juvenilis is also called the flat wart. They present themselves as multiple lesions, usually 1 to 3 millimeters smooth, flat, or slightly raised, and they range in color from reddish to pinkish to tan. They're commonly seen on the face, the neck, and the back of the hands, and they're usually caused by HPV types 3, 10, 28, and 41. Verruca plantaris, on the other hand, is also known as the plantar wart. It is caused by the same types of HPV that cause the common wart, namely types 1, 2, 4, 27, and an additional one called HPV type 57. They present themselves either as solitary papules or groups of hyperkeratotic papules or deep-seated nodules, but still with that distinctive black puncta. And where the papules are seen on the sole of the feet, the skin lines are not seen or are interrupted. The plantar wart usually causes some pain, and patients complain of tenderness when pressure is applied on the wart, like from walking. The usual site of the plantar wart, or Verruca plantaris, is on the ball of the foot, but you can actually see it anywhere on the soles of the feet. Now, Condyloma acuminata is also known as the venereal wart or the genital wart. It's a highly contagious sexually transmitted disease and is actually the most common STD known worldwide. It is caused by HPV types 6, 11, 16, 18, and 33, and present themselves as pinkish, moist, soft, cauliflower-like appearing papules or nodules found in the anogenital area. Here's an example of a venereal wart seen on the glans penis. Here's a genital wart seen on the vulva of this patient. And here is one seen on the perianal area. Warts can be diagnosed based on their distinctive clinical appearance, or they can also be diagnosed with the aid of a skin biopsy, because they do have some characteristic histopathologic findings. On a histopathologic specimen, you will see in a wart the presence of coilocytes with pycnotic eccentric nuclei surrounded by clear halo with large basophilic or eosinophilic inclusion bodies, as seen by the cells that are highlighted by these white arrows over here. Treatment for warts will be types of treatment options that will lead to destruction of the parts of the skin that contain the wart. So examples of these would be electrodesiccation and curettage, cryosurgery, laser surgery, surgical excision, intralesional bleomycin, the application of medications such as 5-FU, cantharidin, DNCB formalin, salicylic acid and lactic acid, which will destroy the epidermis that contains the wart, or the application of 25% podophyllin or imiquimod for venereal warts. Now, what is the course of a wart? Well, in many cases, especially with the common wart or the plantar wart, they may disappear spontaneously. However, there are certain types of warts that may progress to a carcinoma. For example, HPV types 5 and 8 can lead to a form of squamous cell carcinoma known as epidermal dysplasia verruciformis. And cervical cancer has strongly been associated with HPV types 16, 18, and 33, which cause condyloma acuminata. Now let's discuss Molluscum contagiosum. Molluscum contagiosum is a viral infection of the skin caused by the Molluscum contagiosum virus, or MCV, which is a DNA pox virus that replicates within the cytoplasm of keratinocytes. It is common among children and can be spread to other family members, more often among the younger siblings. The lesions appear as 2 to 5 millimeter, firm, smooth, dome-shaped, translucent pearly white to pinkish papules. And each of these papules, when you look at them closely, will have a central umbilication or depression, as seen by these lesions highlighted by these orange arrows over here. You can also diagnose it by a method called Shelley's method, wherein we try to extract the grayish material in the center of the lesion in order to see the molluscum bodies on a slide under the microscope. Skin biopsy will also show distinctive characteristics known as Henderson-Patterson bodies. Treatment for Molluscum contagiosum is also geared towards destruction of the affected epidermis. So we can do this by either curettage, cryotherapy, application of cantharidin, or application of imiquimod. Most lesions of Molluscum contagiosum will spontaneously disappear. However, this could take quite some time because spontaneous resolution of these lesions can take several months to up to a year or so. Meantime, these lesions can increase in number because autoinoculation is quite common, especially with children who like to scratch these lesions or manipulate them. They could easily spread it to other parts of their skin. Secondary bacterial infection is also a common complication owing to the fact that the children like to touch these lesions and scratch them. Moreover, in immunocompromised individuals, larger and more multiple lesions are expected to be seen. In summary, we learned about some viral infections of the skin with distinct dermatologic manifestations. We learned about the different presentations of human papillomavirus, namely Verruca vulgaris, Verruca plana juvenilis, Verruca plantaris, and Condyloma acuminatum. We learned about Molluscum contagiosum, and we learned how to identify and manage these different viral infections.